This is Ashley Walker recording for Tracy Pearson. She will be showing us how to do an enteral tube feeding.
Okay. Hello, my name is Tracy. I'm going to be your nurse today. Can you tell me your full name and date of birth? Good. I came in, we're going to be doing some enteral nutrition with the tube that's in your stomach. Would that be okay? Do you have any questions? No? Okay. I'll walk you through the steps as I'm going so you're familiar with what I'm doing, okay? I'm just going to go ahead and pull this curtain. I'm going to perform hand hygiene. I'm going to come back. Now, Mr. Pearson, the first thing that I need to do is I need to listen for bowel sounds. Would that be okay? I'm going to uncover you here just a little bit. And what I'm going to do is place a towel, okay? Sometimes this can be a little messy. We'll do our best not to let that happen. So I'm just going to place a towel here. Raise your gown. And then I'm just going to listen to your bowel sounds. Bowel sounds are good, they're active. Now I need to just measure your abdomen, okay? So I'm going to measure my patient's abdominal girth. It's important to make sure that when you're doing this, that you're marking on both sides of the abdomen, top and bottom of the measuring tape, so that way, whether it be yourself or somebody else following you that needs to measure abdominal girth, we're all measuring in the same place. Abdominal girth is good. At this time, I would obtain a baseline weight. I need to look at some lab values, assessing my patient for any fluid excess or deficit. I'm looking for any electrolyte abnormalities or metabolic abnormalities such as hyperglycemia. Then I'm going to check my physician's orders, and I'm looking for the formula, the rate, the route, the frequency, and I'm also going to be looking at the flush amount and frequency as well. Now you want to make note that if you have a patient that has an enteral feeding tube that's inserted through the abdominal wall, that you're assessing it for any skin breakdown, irritation, or drainage. His looks really good, so that's good. So, Mr. Pearson, I'm just going to go wash my hands and get my supplies, okay? I'm going to go perform hand hygiene. I'm going to come back. I'm going to take a look at my formula. So I'm looking at my formula. I'm looking at the integrity. It looks really good. I'm checking the expiration date. It is not expired. It is room temperature. So I'm going to go ahead and shake that. I am going to go and wash my hands, and now I'm going to put on my gloves. Are you doing okay? When I get my gloves on here, I'm just going to raise the head of your bed. Can you tell me your full name and date of birth? Good. I need to sit you up at about 30 degrees. Okay. Perfect. Are you comfortable? Okay. So, Mr. Pearson, the first thing I need to do before we get started is I need to check for tube placement. Okay, so what I'm going to do is I'm going to get my syringe here. And I'm going to drop anywhere between 10 and 30 mLs of air. Good. I'm just going to be listening to your tummy here. I'm looking to hear a swoosh sound. If I hear a swoosh sound, that lets me know that the tube is in the correct place. So I'm going to slowly administer 30 mLs of air. And I did hear the swoosh, so that's good. We're in good placement. Okay, so now I'm going to pull back residual until I meet resistance. And while you're pulling back the residual, you want to make note of the appearance of the residual as well as the amount. And it looks like we're meeting resistance at 40 mLs. So, because it's less than 200, I'm going to go ahead and push all but 1 ml back in. I need to check the pH with that 1 ml. You also want to make note that if you're doing an intermittent enteral feeding, you're going to want to check residual every, you're going to want to check that before every feeding, and if it's continuous, you'd want to check that at least every 4 to 6 hours. So we're going to go ahead and check the pH of our residual, maybe. And the pH looks good, so we can go ahead and start our feed. Before I do that, I need to measure out. The doctor's orders that I looked at indicated that I need 2 10 ml flushes and a 20 ml of nutrition. So let's go ahead and do that. I've already shook my formula. So we got 10 mLs of flush, another 10 mLs of flush, and then we're going to give 20 mLs of nutrition. Good. Okay. So we can go ahead and get started with our enteral nutrition. So the first thing I want to do is I'm going to flush this with 10 mLs of water, okay? And now we're going to put in our nutrition. And we're going to flush that tube again, okay? Good. You always want to make sure too, if you're not administering enteral nutrition, that you have the proximal end of this tube clamped at all times. At this time, I could go ahead and wash my syringe, my bag, and my tubing in warm water. And you want to make sure that you're getting a new administration kit every 24 hours. I would then take a look at the site. I want to wash with warm water. I want to rinse it. I want to pat it dry. I can leave it open to air unless there's a specific order that states that I maybe need to apply a drainage sponge. Everything is good. So now, get you covered up here. Dispose of this in the appropriate location. I'm going to take off my gloves. I'm just going to wash my hands. So I'm going to perform hygiene. I'm going to apply gloves, reapply gloves. I'm going to provide oral care. So we're going to get you a little freshened up there. And then I'm going to take off my gloves. I'm going to wash my hands. And Mr. Pearson, are you comfortable? Because I'm going to need you to remain in this position for at least 30 minutes. He's comfortable. So I'm going to go ahead and lower your bed. I'm going to put the bed into the lowest position. I'm going to make sure my patient has their call light. If you need anything, don't hesitate to give me a call. I'm going to come back in 30 minutes to check on you. When I come back in 30 minutes, I want to evaluate my patient's respiratory status. I'm going to check a blood sugar on them. And I also want to make note of their comfort, making sure that they're not nauseous or vomiting, that they're comfortable. I'm going to go ahead and wash my hands and document the procedure.